reproductive system.
And
And for that, I like to share with you my screen.
क्या हो क्या रहा है?
So today we'll be talking about a review where I'll be going through the female reproductive system. So guys, is there any problem? Can you hear me well? Any issue?
All is good, doctor.
Okay, if there is nothing, so I can start because time is over now. So I can start the ball rolling. No, still there is 1 more minute to go according to my clock. So I'll wait for 1 more second. So basically today I'm not really bringing something new. It's just what we have learned over previous learning session with you, what you have spent at Al Faisal. So we'll be just going through basic and main and major concepts, and we'll try to go over the things which are really needed. So I think I should start. So the objectives which I'll try to cover today, my objectives will be, at the end of this session, we should be able to discuss the organs who are contributing to the female genital tract, and then we should be looking into some of their major anatomical features, so that what we need to look in that. So these are the objectives. Let's go further. So we need to look about, now what I'm showing you the uterus. But before going to that, the female reproductive system has been divided into upper tract and a lower tract. So what structures do we need to put in the under the category of upper tract? So upper tract includes what? Uterus, the fallopian tubes, ovaries, and cervix. So these structures are being called or being said that these are the structures which are part of the upper tract. And vulva and vagina has been said they are the structures which contribute to the lower female reproductive tract. But the upper tract, all what we have in upper tract, what do we have in upper tract? We have uterus, then we have fallopian tubes, we have ovaries, and then we have the cervix, plus vagina. That is not part of the upper tract. They are present where? Within the pelvic cavity. And the vulva part of the female reproductive system, that is where? That is located in the perineum. So this differentiation should be very clear, that our female reproductive system is being divided into upper tract and a lower tract. And when we talk about upper tract, we should be very clear. We are talking about uterus, fallopian tubes, ovaries, and cervix. And when we are talking about lower tract, we were talking about vulva and vagina. And when we're talking about their location, so on the basis of the location, uterus, tubes, ovaries, and vagina, and plus cervix, they are present within the pelvic cavity proper, and the vulva part is located within the vagina. So now, looking into the features of the uterus, you can see that we can divide it into, there is a fundus part, there is a body, and then there is a cavity, the uterine cavity, and then this part is, we call it cervix. It has its different part, external os and internal os, and then there's a canal in between, and it's been telescoping within the vagina. And on the sides we have these tubes, and these tubes we call them fallopian tubes, and they have finger-like processes at their end, which we call them fimbrias, and they are in close approximation with the ovaries, and they are basically receiving the ovas when they're ready to go further. So let's look into other associated features which are connected to my uterus, and there we need to look into the uterus is located where? We need to be good at it. It is located behind the bladder and in front of the rectum. So once it is located behind the bladder and in front of the rectum, so there we have spaces in front and behind. The space between the urinary bladder and the uterus, we call it vesico-uterine pouch. And then the posterior space, the posteriorly we have rectum. So the space between the uterus and the rectum, we call it pouch of Douglas. And cervix is the most distal part of the uterus, and that is protruding into the fundus of the vagina. And most of the uterine body and the posterior supravaginal cervix are covered by peritoneum. So this much part of the uterus is covered by the peritoneum, but the rest of the part is not. So these points needs to be very clear. Going further, now what are you looking at? You're looking at a uterus, tubes, and you're looking at the pouch of Douglas. This is a view which has been taken with the help of a laparoscope. So we are in the cavity of the pelvis. You're looking at the fundus part of the uterus, and then you're looking at these fallopian tubes. Look at it. If you can stay focused in this image, you can see the ovaries which has been shown. And this shining surface that is reflecting, the light has been reflecting over the peritoneum. Which peritoneum? The parietal peritoneum. And this is a view of a laparoscopic view of a human uterus. And this image is 12 times magnified. Let's look at it. If we look at the uterus, on the side of that, we can identify these structures, the round ligament, and then the fallopian tube, and this is the ovarian ligament. And you can see that there is this partition, this curtain-like structure, which is basically the fold of the peritoneum, which has been thrown over these tubes, and that we call it as the broad ligament. So you can see these so many structures are enclosed within the substance of this broad ligament. So this whole yellowish thing is called the broad ligament, and we need to be clear about that. Going further, now uterus primarily, there are three layers which are contributing to those layers are, we have endometrium, myometrium, and perimetrium. So how they are placed, let's look further. So now under microscope, a photomicrograph has been shown, and that is showing you the secretory phase within the endometrium. So this is how it looks under microscope. Going further, now this is another picture of the same photomicrograph and early follicular phase. I'm sure you are good with this. What is happening? So the uterus is being, we have the processes where uterus is preparing for implantation if there is any. And then going further, now this phase of the endometrium is showing you mid-follicular phase. So these phases you need to be, you're expected to be good with these phases. And coming down, so late proliferative phases. So these are the different histological appearances. These changes are occurring when the process is going on, and how there are different modifications are occurring. Uterus is getting ready, getting waiting for implantation to occur. From where the implantation is occur, when a sperm reaches into the cavity, it travels through the tubes, it receive, if it founds an ova which has been erupted from the ovaries, and if they meet, there is a process of fertilization, and then this fertilized thing, when it moves down to the cavity of the uterus, it's ready for implantation. So before implantation, all these changes are occurring to accommodate this new visitor. And if it happens, the pregnancy continues, and if it fails, the normal menstrual cycle begins. So everything being shred off. So these are the different changes which I have tried to cover over within these previous slides. Going further, so lastly, the luteal phase. So you can see that endometrium and how these different changes are apparent under the microscope, and you are expected to have some idea about these things. So now, what next? So we have looked into the uterus, and we have talked about different associated things. So now this is a broad overview of female reproductive organs, and what has been visible to you. You can see the uterus, you can see the fallopian tubes, you can see the ovaries, the fimbrias. Ovaries are here, fimbrias are here. These are the ovarian ligaments are visible, and then you can see it's not placed vertically, it's placed slightly horizontally, it's bended forward, and then it's looking into this part of the uterus is called vagina, the cervix, and cervix is looking in. This is the whole tube is the vagina, which is externally. This is the vulva, where we have the labia majora and minora and the other associated structures. And then you can see it's a highly vascular organ, and there you can see these internal iliac vein and artery, because internal iliac artery is the prime artery which supplies these female reproductive organs. So this is a broad picture. This image should be very clear that how these female reproductive organs has been located and have been placed within the human female body. Now let's go further into the further detailing. So look at the blood supply and see the contribution coming from the internal iliac artery, and there's a main source, that's the uterine artery. And see, it comes and it has a tortuous course. The uterine artery has a tortuous course and it goes all the way up and down. Why it is tortuous? Because when this uterus go gravid, when it's been pregnant, so it enlarges in size. So this torsivity, this spiral appearance will help the enlargement in size of the uterus. And this little table which explains here the what branches has been contributing to supply the uterine artery and then the ovarian. So this is how they have been. We can receive the blood supply, and it is highly vascular organ that we need to be good at it. Primarily it is coming from internal iliac artery, and that's the uterine artery. And you can see that the close relationship of ureter and the uterine artery. This is a real important landmark, and you are expected to be good with that. Because what happens, different surgical procedures, you might, while you're trying to ligate, while you're trying to have a control over bleeding, and if in attempting to do so, there are fair enough chances, a closely associated structure can be tied up. And if that happens, that's a disaster. So you can see the close association of the ureter with the uterine artery. I hope this concept is clear. Going further, this is another important concept, because when we are able to diagnose someone has a malignancy, someone has a cancer of the cervix, quite common. So the next question which has been asked by the patient and the family is how long this person will survive. So to answer this how long, you are expected to be good with the lymphatics, because after diagnosing, after having a tissue diagnosis of a disease like cancer, the next step is the staging of the disease. So how you understand the staging of the disease, one of the essential parameter for learning the staging part of the disease, you are expected to be good. How the lymphatic drainage of this organ, what you're targeting it, is being spreading, and which lymph node you should be sampling at, because I'm sure by now you all know what is an organ confined disease and what is a metastatic disease. And going further, you will be learning more of these concepts within your pathology lectures and all that. So lymphatic, an overview of lymphatic is really important, and you are expected to be good with that. Going further, so we have talked about the uterus and its different associated thing. So now what is next? Yes, the position of the uterus, how it has been placed in human body. You can see that you have seen in the previous images that the body of the uterus was not vertical, it was lying horizontally. And if you can see here now, it's sleeping over, it's above the surface of the urinary bladder. So, and there are certain angles. These are axes. You can see this green line, you can see this blue line, and you can see this red line. These lines are important, and that we need to understand. So uterus is most commonly what? Anteverted 90 degree and anteflex by 120 degree. So these are the important variants where you are expected to be good with these variants. Looking further, now you can see the degree of retroversion. So there are different degrees, but this is normal, and these are deviation from the normal. So it can be placed in different. You may find your patient who you are examining, who you are dealing with, is not having a uterus which is placed normally, it is being deviated. So these are the different degrees, so you can stage it. That's the first degree, second degree, or third degree of retroversion. So it is deviated from its normal position, and these are something where you need to be connected. Rest is fine. So now going further, looking inside, what you can see there is what you can see here, the normal position of the uterus, and then This is what it's totally gone opposite. So that is a change, and that is deviated with retroflexion. So you can see the normal position of the uterus, and you can see the abnormal position of the uterus. So these are understandable, expected to be good, and you'll be learning about these things within your upcoming rotation and upcoming slides. Now, after we talk about position of the uterus, I'm sure everybody knows how a uterus should be placed, and if it's not following, then it's there we can explain it in terms of there are different degrees of explanation for that. After learning that, then we'll be coming to the supports of the uterus. So, what are these supports? If you look at, you're looking from the top, and you can see there are certain these fibrous whitish fibrous structures which has been shown up here, and these are primarily providing support. So they are keeping these organs within their positions. So if these supports have become weak or they are damaged, as a result, what we can have certain problems, and these problems has been labeled as a name called prolapse. So how these supports are meaningful, let's look in that. So there we can see there are different ligaments you have seen in the previous pictures, and these ligaments have their name: the broad ligament, round ligament, cardinal ligament, ovarian ligament, and infundibulopelvic ligament. So these pelvic, and this is the structure, how they are made up of, what is their, and these are their description and what they are containing. So this is important. These names are important, and if you try to go back, you can see that all of them has been shown to you here within this image, and they are really helpful within these areas, and you are expected to be good with all these landmarks. I'm sure things are fine. Okay, so we talk about this table. Going further, now what I'm trying to show you here, look at it. You are examining someone's vagina, and there you can see, is it a normal or not? There is a bulge which is visible here on the vaginal examination. And what happens? Look at the uterus. It's not placed where it has been. It is coming downwards, and this coming downwards is called prolapse. And there are stages, there are the degrees of prolapse, and it may come all the way down, and it may pop out of the external orifice. So these are basically where it happens, where we have shortage of the supports. So if supports are not there, so this organ might prolapse, it might be popping out, and that we need to be clear about. And then we can see that this bulge is being further increased, and there you can see this uterus, this whole thing is being further seen going down. Are we clear about that? Okay, guys. So going further, so we have talked about the uterus, its positions, and its supports. Going further, now we can see that this is what I'm trying to show you. I'm trying to show you here the organization of a female pelvis. The bottom line is why we need to be good with the why there are difference between a male and a female pelvis, because female pelvis is designed for this process. And what are you looking at in this image is the process of the childbirth. So this big diameter is required, which facilitates the passage of the head of the baby and the whole body of the baby. So all the structures are wide apart, all the measurements are, so this whole thing should be more open, more wide, so it can facilitate the descent of the baby in a nice way. So these parameters are, if I compare, I'm not comparing at the moment, but if I can compare a male pelvis and I'll place it with this female pelvis, so there should be a big difference, because male pelvis is not designed for delivering of a baby. So everything should be close by, every angle should be here, they are obtuse, there they should be acute. So this difference should be very clear. And why all this is happening? Because we have to accommodate the descent of the baby. I'm sure things are clear. So going further, so now these are the different shapes of the pelvis of the of a female. So you need to be good with that. And if we look into the details further, so there are different variants: the normal, and then we have symmetrical, asymmetrical, and these are the different variants whatsoever happens. So this is the normal, and these are the abnormal variations. So these things, it's good to know. So you should have some idea that what happens, why I'm not calling this shape as. So if I go back, So this, to me, it's more acceptable than this and that. So why that's so? If these are the situation where they are related, why we need to know about them? Look, when we are knowing about something, there should be some connection to that. So when we are talking about a normal delivery, when we are ready for a normal childbirth, but if there is some deviation, it means this will be obstructing the normal descent of the baby. And if we, during antenatal clinics, if we find these kind of disparities, we need to be well aware of beforehand so we can handle these things. Okay, so now this slide is showing you different kind of measurements, and these measurements are really important. On the basis of these measurements, we can predict that the outcome of this pregnancy will be a normal vaginal delivery, or it can be a C-section, or you might need to do some instrumentation, vice versa. So you can plan ahead of time. It's not on the 11th hour. And how it's been possible? If this female is being evaluated during her antenatal time. So if after she's been diagnosed that she is pregnant, these measurements are essential and they are really helpful. And this table shows you some of the acceptable values, and these values are really needed. You are expected to be knowing that what are these measurements and what they mean, that what is the level of the inlet and what is the level of the outlet, and then the mid pelvis. So these measurements are really important, and you need to be good with these lines and these detailings. Are we clear about that? So after this, now let's talk about the cervix. We all know this is the lowermost dependent part of a female genital tract. So within the cervix, what it is a fibrous cylindrical part of the distal uterus, and it is, to one end we have external os and to one end we have internal os. So there are two openings. So the cervix begins with the internal os and end as an external os, and it's the lowermost dependent fibrous cylindrical part of the female genital tract. And then there is a canal, and there these are the os. So now when we look at this cervix with the help of a colposcope, we can have an image like this. So this image is there, and what are you looking at the moment? An instrument has been passed through the vagina, and you can see this is the external os, and this is a human cervix. This is a real image which has been taken during an examination. So you can see this is the wall of the vagina. These are the fornices, and this is the external os, and this is the cervix. And if someone has some growth, some malignancy, so that people can take pap smears. So these samples has been taken from these areas. Are we good? Going further. So basically, primarily it composed of what? Endocervix, cervical transformation zone, and ectocervix. So these are the different components of a cervix, and let's look at under microscope. So this is a photomicrograph which is just showing you, you can see that external os and how it appears. So under microscope, the cervix appears something like that. I hope we are clear about this fact. Now, what you need to learn here, look at it. Before puberty, what was the status? During pregnancy, premenopausal and postmenopausal women. So these are the changes, and you are expected to be good with these things because cervical cancers are quite common and they are quite seen. And when you'll be going to the clinics, you'll see them a lot. After that, now we need to talk about vagina. Vagina, we know that this is a muscular tube which is located where? In the true pelvis. To one end we have the vulva, to other end we have the cervix, and you can see in this image. And the surrounding, where this cervix is been popping into the vagina, the circumferential zone all across, we call it fornix. If it's anterior, we call it anterior fornix, posterior fornix, and lateral fornices. And look at this ruggies, the vaginal ruggies. So this is the organization. If we go into a female body, into the pelvis, you can see that how the uterus is being located. Cervix is looking into the vagina, and you can see these fornices. This is the rectum, and this is the urinary bladder, and this is what they are opening in the perineum. So this is the vagina. And then, so we need to good. be good with that. What are the structures which are present in front, who's behind, who's superiorly, and who's below? So in front, anteriorly, what do you expect? Urethra and bladder. Posteriorly, rectum. Superiorly, we have the pouch. We talk about that, pouch of Douglas, and distally we have pelvic floor and the vulva, where this whole set. And who makes the pelvic floor? There we have a contribution from a muscle. I'm sure you'll remember that levator ani, coccygeus, and piriformis, they all contribute in making this pelvic floor, and that is one of the contributing factor which is preventing the prolapse. Are we clear? Going further, fibromuscular structure. So this is the histological pattern. So we have inner muscular layer and external muscular layer. So this is how it's been made up of. And then under microscope, a photomicrograph is showing you the structure of vagina under a microscope, how it appears. So why I'm bringing these photomicrographs, why I'm bringing these histological images? Because once you'll be learning the pathology, you can differentiate what are the different cell lining and how and where they are present. So you need to revisit those concepts. That will be helpful and meaningful for your understanding. Going further, it's the time to say thank you very much. I have tried to go over the main and major contents and of the female reproductive organs. Is there any questions? If you have any question, guys, is
Oh,
there any questions?
okay, doctor.
You can write me in the chat or you can talk to me. No question?
Doctor,
Yeah,
could
you, Wafa, I will share with you slides. Don't worry. You'll get it. I will post it on the Moodle. Relax. Anything else I can do for you guys? So if you don't have any question, yeah, same from me. Thank you. Bye bye. Take care.